Hello and welcome to our presentation. Today we are joined by Madeleine Burnett and Jordan Myles, along with myself, Elizabeth Haynes. And in line with the current Mental Health Week, we are going to discuss the promotion of psychosis and give you a little bit more of an understanding in regards to it. Throughout this presentation, we are going to discuss the pathophysiology of the disorder, assessment, treatment and nurse interventions required to support an individual suffering psychosis, and what impact psychosis may have on the individual, their family and the community. So first off, just a brief understanding of what is psychosis. Psychosis can be described as a mental disorder that can affect the individual's capacity to differentiate between reality and delusions. This may result in a confusion, slow thinking, or believing, sensing things that are not real.
There are many causes to mental disorders, and they can be similar to what can cause each other, but the ones that are specific to the etiology of psychosis are as follows: genetics, early childhood development, adverse life experiences, drug use, and other factors increase your chances of experiencing psychosis. As it can be seen, there are many factors that can contribute to developing not just psychosis, but mental disorders in general. It was discovered in the 1950s psychosis is the result of an imbalance of dopamine in the brain. And new research shows that epigenetics and phenotypes are going to show a deeper understanding to the pathophysiology of psychosis.
When it comes to caring for patients, nurses play a very important role in a lot of the time, are responsible for judgments and decisions made in healthcare. Nurses do this by using the clinical reasoning cycle numerous times a day to ensure patient-centered care is achieved. Levitt-Jones describes the clinical reasoning cycle as a process based on the research Hoffman back in 2007 and is broken down into 8 stages. Considering the patient, collect cues, process the information, identify problems, establish goals, evaluate outcomes, and reflect. Each of these stages assist a nurse when it comes to patient-centered care. Further research has been done in 2018 which has found patients experiencing a psychotic disorder benefit from patient-centered care. Although the patient may not be able to participate in their own care at times, there is research finding that the patient will still benefit from person-centered care at this time.
The assessments nurses undertake for their psychiatric patients are quite in-depth and can be intelligent with how they handle the patients too. Nurses will have to build trust with the patients so that they are able to ask some more in-depth questions, and also to not make the patient feel as if they are being interrogated during these assessments. The use of the mini mental state examination is an assessment with 30 questions and is able to assist in the assessment of the following person's abilities: short-term and long-term memory, attention span, ability to plan, the ability to understand instructions, concentration, and their language and communication skills. The maximum score a person can have is 30, and a score above 25 is seen as normal, whereas a score below that is seen as abnormal and may need either a repeat of the test or further understanding of the person before coming up with a hypothesis of the patient's condition. Treatment of psychosis is mainly through the use of medications and some psychosocial therapy. Evidence-based treatments are the only source of treatments that are considered, as medical professionals do not want to make the symptoms worse for the patients that are seeking help. Treating a person that is suffering psychosis may require a team of health professionals, and that can include the use of a psychiatrist, psychologist, mental health nurses, and occupational therapists. The importance of having a multidisciplinary team means that each health professional has been trained in a different way that allow them to analyze and pick up any traits the person may be presenting that the other health professionals may miss. The psychiatrist is a medical doctor who has chosen to specialize in mental health, which does include substance use disorders. These physicians are qualified to assess both the physical and mental aspects of psychological problems. People who present to a GP with psychosis or other mental issues can be referred to a psychiatrist. This is due to them being more capable at prescribing the right medications to the right person, and even use psychosocial therapies to help in the aid of controlling symptoms. The class of medications that are typically used to treat people suffering from psychosis are antipsychotics. People can be on a range of different antipsychotic medications, as some medications can be non-responsive or not tolerant to the other antipsychotic medications that other people can be on.
Interventions include the use of the clinical reasoning cycle, person-centered care, the mini-mental state examination, and health professionals such as psychiatrists, psychologists, nurses, and occupational therapists. Psychosis can have a toll on an individual, their community, and their family, as the individual suffering from the mental disorder may have a decreased ability to perceive and accept reality. One positive impact the family can have is helping to early diagnose, as they are usually the first to witness the symptoms of the affected individual. A negative impact can be that it causes stress and strain on the relationships they have. A positive impact of the community can be that they help educate people within the community to reduce stigma and also help treat that person. A negative impact is that the loss of productivity and other healthcare costs can cost up to $73,000 per annum per individual. There is also the impact of relapse on the individual. This can make the person feel hopeless or helpless and increase their recovery time. From this, we realise that the impact of psychosis does not only affect the individual with the mental disorder, but spreads to their family, social network, and wider community as well. We hope this has helped you better understand psychosis and the impact it has. Thank you for your time.